Good morning, everybody. Thank you for coming to us today. We are very pleased to welcome all of you for this full day dedicated to digital health and wellness during this Mobile World Congress 4 years from now. It's been a decade. We have worked with the ECH Alliance, with GSMA, and 4 years from now to develop an agenda and specific conferences dedicated to our domain, the digital health. It's been a long journey for us and for you as well, all the stakeholders working on digital health since many years. This last decade, I've seen digital health explode in terms of usage, in terms of business models, in terms of new technologies. And of course, it has been an interesting journey, and we will try today to see where we are and where we go together. And the idea of the event, as you know, for the one who attended the previous events, the idea is to have more interaction between the speakers, between you in the audience. During the networking session, we will have several networking sessions during the coffee breaks, during the lunchtime. So feel free really to intervene, to ask your question. We want this event as dynamic as possible and as many exchanges as we can. So I'm pleased to introduce this event with my colleagues from ECH Alliance. Carolina and Andy are with me here to introduce this event, and we are very pleased to again organize this Digital Health and Wellness Summit in 2022. Actually, it's been only 6 months or a bit more than 6 months since the last event, because last year it was in June. Pandemic was there, still there, but we have more freedom now, and we are here without mask in the stage, which is nice, and without too much distance between you. So we have a few slides just to introduce a bit what we are doing at ECH Alliance. We wanted to take the opportunity to update you on what we are doing and what we have developed this year. So ECH Alliance is growing. Since 10 years, we have created this non-profit organization, growing and growing, now reaching partners and members and experts in digital health in more than 78 countries, covering a large population, 4 billion people, not 8, because it would mean that we cover all the planet. So a large number of population, more than 20,000 members in this community, people interacting with us. These members are companies, our academic and research team, our hospitals and healthcare professionals, our startups, or policymakers and governments. So a very large multi-stakeholder membership, 900 organizations being member, and international ecosystem, and my colleagues will explain these points. We have developed as well recently an initiative, and we have the chance to have Anne Mond here with us today to talk about that later on today as well. Anne, who is the president of HATA. We have built with some big and leading organizations in the world what we call the Global Health Connector Partnership that you see here. Organizations such as HATA, the American Telemedicine Association, like the Health Parliament in India, like the Commonwealth Digital Health Center, the African Health Business Association. So we have tried to link up with different partners in all the continents across the globe, because we think, and especially after this pandemic, we think that a global action is necessary, is needed, global collaboration are needed, and what better to partner between membership organizations having a huge network in their area. So that's what we've done with the Global Health Connector, developing some specific topics and thematic area this year. Around health inequalities and disparities at the global level, trying to tackle as well the question of digital skills for the workforce, which is a very important topic facing the shortage, and data and digital services, data, a topic that we will find all along the agenda today, very important at the moment, and we will talk about data governance, data privacy, a certain number of topics with our great speaker today. And we have some flagship events as well, because a community works every day together, but it's nice to meet sometimes like today and to discuss about projects, discuss about topics, and what we try to do in different points of the world. And you have here a few events we are launching. So of course the Mobile World Congress this week in Barcelona, but as well the Vive event in a few days in Florida, and we will have a big action there. And I will mention as well the ATA conference, annual conference 2022 in May in Boston, which are very important events, and we invite you to welcome you to attend these events, which are very interesting gatherings. I will let you, Andy, to continue, give you the clicker to talk us about the community.
Many thanks, Julian. Many thanks. Okay, I want to briefly introduce this idea of a community to you. People talk about communities, and they get a bit nervous about what they mean. I don't. For me, it's quite clear. We've built and established a long-term community of people who work in health over now, it's getting on for 11 years. And we've created and bring together those members, those partners that we have in our ecosystems. Now, a lot of people like to complicate the word ecosystem. There's lots of references to it all through the hall today, you'll see. I don't like to complicate ecosystems. They're quite simple. They bring together all the stakeholders of health, from the patient to the consumer, to the carer, to the university, to the policymakers. Bringing them together, all the people you can see in the diagram in front of you. Because without all of those people involved, it's a talking shop. That's a little bit controversial for this time in the morning, but it is, because otherwise it's just about sharing best practice without listening to the need. It's about talking about problems without finding a solution. So we're here with our ecosystems to focus in matching need and solution. We do that by breaking down the silos that exist between organizations, and increasingly, because of the way we work, within organizations. We're there to transform healthcare. What does that mean? It actually means something radical, like doing something, okay? Instead of just talking about it. Changing the way we work by collaboration, by matching that need and solution. And then lastly, it's about creating economic opportunity. But you'll see with the diagram behind you that patients and carers are at the center. That's important, because we lead with a need. We've set up and established now over 70 ecosystems globally, which the pace of which the growth has been huge over the last 2 years because of the pandemic, because people get the idea and the concept of working together and collaborating globally. We've seen them open in Australia. We've seen them partner with people from South Denmark. We've seen progress in Argentina. We've even opened up in Japan and in Iceland because they get the idea of connecting up those dots in their health systems. What's happened is our ecosystems have also made some demands because they want to collaborate. They want to collaborate on projects. We'll hear more about those from Caro later. They want to collaborate to make differences and learn lessons and share practices and needs across the globe. So what we've done, we've had to change. We've changed and adapted the way in which we moderate. When we used to only concentrate on geographical regions, we now bring in a concept of thematic ecosystems. The idea here is the same concept, matching need and solution, but on a thematic with subtopics underneath. I'll pick one. Skills for health. We've looked at skills for carers and citizens, skills for frontline staff, skills for digital health professionals, and how to onboard and recruit. Matching need and solution. Simple concept. I'm here today, I want to meet all those people who want to get involved with these ecosystems. These are great places to get collaboration going. They're even better places if you're interested in projects. And I know, and I see many of you here who've been project partners with us in the past. We know who you are. So come and speak to us about getting involved with these. All these topics will be growing over the next year. I did promise to make one announcement today, which is by the end of 2022, we will also cover 2 new topics. One of them will be on the menopause, which all of our ecosystems are now raising a hand and saying, we realize that was a problem after all. Hi to the people from Finland. We're also going to be targeting the area of cancer, because our ecosystems have said, that's where we want to go. Come and speak to me later on. I'm going to pass you over to my colleague, Caro. Thank you very much.
Good morning, everyone. It's my pleasure to welcome you all here, also on behalf of the innovation team of the ECH Alliance. I think Andy already teased what we do in the innovation team and what is our work about, and also said that here in this audience there are some of our partners from our projects, and we are very happy to have you here with us today. And well, hopefully also we will be able to create new partnerships and new collaborations for the future. So what is our innovation team doing in the ECH Alliance, and how do we support our ecosystems, our members, and our partners with our work? So we have the extensive experience in fundraising and in partnering in R&D consortia and supporting the transformational projects with the communication and dissemination expertise, and of course having this very wide multi-sectoral network of members, partners, ecosystems really help us to get the message through, really promote the results of the projects. Then we also deal with the exploitation and sustainability, because of course we all want to see the solutions that we develop for years be implemented, be used, and also for the companies to make money out of them, make good business, and at the same time, of course, provide a value to the society, provide a value to the citizens and to the patients. So we ensure that the solutions are sustainable and that the impact is also visible after the project ends. Of course, the user needs assessment and stakeholder engagement, having the access and having the network of the people from different countries, from different sectors, from different levels of the governance, local, regional, national, EU, and global, allows us to support our projects this way. And currently we have, you see here some of our projects that just recently ended, and currently we have the 9 active ongoing projects in the different domains. So here you can see what are the topics that we specialize, that are that have been in our focus for the recent years. But of course, as the topic of digital health is so broad, I wouldn't say that this list is exclusive. I think like that there is a lot of great opportunities coming in the future. But the same as Andy said with the choosing one of the ecosystem, I will highlight the digital health and data policies. Of course, this is the very hot topic currently, with a lot of different changes and developments on the EU level in relation to the primary and secondary use of data. And of course, we also support the uptake of digital solutions and making sure that the supply and the demand sides can meet like they do today here at this event. So that's briefly from me about the projects, and of course, feel free to reach out at any time if you have an idea, if you would like to collaborate, or if you need a good partner for your consortium. Thank you.
Thank you, Caro. We had an overview of what we are doing, so really feel free to contact any of us in the team to start to collaborate, start to develop projects, and we would be pleased to have many conversations during these days. A few comments about the agenda, what we will discuss today, what is the program, what is the menu of the restaurant. The starter of this day will be around a very, very important topic from my point of view, a topic of trust. The trust we know in healthcare is very important, in digital health is very important as well, and topics around data governance, privacy, around AI. AI is only a technology, I would say, but having a huge impact on the way we are managing healthcare systems. So we will have a panel session with really high-level international experts talking us and explaining us their vision, their views on this topic and difficult dilemma sometimes between innovation and privacy protection. Then we have the chance to have an address from the WHO. After these 2 years of pandemic, it was interesting to have the view of the WHO about the digitalization of health or digital transformation of health, and Samir Pujari will explain us his vision. Then we will have another track around the vision from different perspectives. We found interesting in this international event in Barcelona, the Mobile World Congress, to understand what is the vision of the evolution of digital health, the state of play at the moment, but the evolution in the next year, from a global perspective, the WHO, but as well from the US, from an investor vision as well, point of view, because they are making the startup of tomorrow and the solution of tomorrow, and from, at the end, European vision as well, and we have the chance to receive the representative of the EU presidency at the moment. France is ensuring this presidency, and Luisa will explain us. And the next generation program as well that Caro will detail us after. And then in the afternoon, we will have a series of keynotes addressed, very interesting, about very key topics and key transformation we observe in the healthcare sector for transformation acting at the moment with concrete and tangible examples. We wanted this conference to be as close as possible from the ground, from the real life, and we will have real life examples of application. And we will finish the day with a session around real, tangible business opportunities that you could have in the following weeks. Here, in this case, we will showcase 4 business opportunities for the companies interested to participate with policymakers, in this case, because we are talking about public buyers here, to participate in some very interesting projects in very different fields. So this is the menu of the day. Thank you. Thanks to my colleagues for helping me on this introduction. Thank you to come to see this conference. And we will move on to the next panel at the moment. Thank you very much to be here.